everyone. It's Wellness Day. It's Wednesday Wellness Days. Thank you for joining us. I have Dr. Keith Berkowitz on today, and we're going to talk about PCOS. So you've been asking, and I am going to be delivering. And it's like, why do us women have all these issues, right? Like we have, PMS, we have PCOS, we have perimenopause, menopause. So all of these different concerns is because we have more hormones than men and are sophisticated. So here we have Dr. Keith Berkowitz joining us from New York to talk about PCOS, polycystic ovarian syndrome. Keith, thank you for joining us today.
Thank you for having me.
So let's talk about PCOS. First of all, how is it over in New York? I heard your power went out. Is everything okay?
Yes, it went back on. So they were working on our street and they decided to shut off our power in 90-degree weather. So right. It was nice of them.
Oh, wow. Interesting. Oh, is it 90 degrees over there?
It feels that way now, but it's probably in the 80s.
Okay, okay. All right. Well, let's talk about PCOS. For everyone joining us today, we had a lot of feedback from people asking if we could please talk about PCOS. And again, if you have anything you want to talk about, please feel free to send us a message and we can do it. We're doing this every Wednesday. And so we're really excited to do this with you today. Keith, why don't you tell everybody what PCOS is while I sip on my turmeric latte?
Which will help with hormones as well. So PCOS, as Dr. Nigma said, is polycystic ovarian syndrome. So it's a syndrome of, we call inappropriate hormonal balance. We've been talking about weeks before about thyroid, hormones, blood sugar. Well, along that same line is actually PCOS. Where the controversy is about it is it's looked at two different ways. It's looked at as a hormonal imbalance where women make excess androgens, which is what we call testosterone, and at the same time, another insulin resistance syndrome, another syndrome where the body makes too much insulin for the given glucose. And because of that, the treatment can vary, depending whether you go to an endocrinologist or a gynecologist, right? You go to a gynecologist, she could be treated with hormones. You go to an endocrinologist, she could be treated for blood sugar disorder.
Yeah, it's interesting. And I was just with my gynecologist yesterday, and she's a good friend of mine, Dr. Shamsha Mercy. I'm going to bring her on one of our Wellness Wednesdays. She's amazing. She's an obstetrician and a gynecologist, and she's incredible. And, the first thing she said to me was, Nigma, I don't understand why these conventional docs put people on birth control pill, because it really messes people up. And, it's something you and I know, but it's like the conventional method is just so textbooked. It's like, you have this, let's put you on the birth control pill, and that should normalize it. That makes a lot of sense, putting an artificial hormone in someone to normalize their cycle. Okay. It's one of those things. I think, we have a high prevalence of women that have this, that are actually, I know there's the statistics for up to what, 20%, 10 to 20%?
Absolutely. And depending on the ethnic group, it can vary even higher. So, they suggest probably between 5 and 10 million people in the United States. And why it's so important is that's infertility's ability to have a child.
Yeah. Yeah. Not only that, but it's like there are a lot of women that are not diagnosed with this condition. And that funny Instagram post that I posted with all the different features of what it could look like for PCOS. Keith, why don't you tell people what they should be looking for? What would people, look out for if they wanted to see, do I have PCOS?
Okay, great. And I love that post, the cartoon stuff. And you're the social media expert, and I'm learning. I'm getting it. So what happens is you look at things. Number one is actually amenorrhea, or not having your menstrual period. That's one of the most common symptoms. The one that actually leads to a lot of the misdiagnosis or undiagnosis is it can cause obesity. But up to 50% of people, I know you like statistics, are not obese. So it's often that group of individuals that don't get diagnosed. Otherwise, it's hirsutism, where you have excess of facial hair. Hair loss is another
Nobody
one.
wants that. Nobody wants a mustache.
Yeah, or men want hair on the head, but
Yeah.
but that's one, and it's body hair. It could be both on the face and also on the body as well.
Yeah.
Other things, acne is a big one. Where, you always talk about skin. One of the most common causes of acne in women, and other things, anxiety, fatigue. It's so interesting. Every week we talk about a different syndrome, but a lot of the symptoms are often the same, and it always teaches us how the endocrine system is all interconnected.
Exactly. And with respects to acne, if you're getting acne that's like pustular acne, that's a really interesting, especially around this area here, the chin area. It's a hormonal area in traditional Chinese medicine when we're doing the face mapping. Super important to make a note of that, of when does your acne, when do you break out? Is it before your period? All of those things are really important. They're keynote symptoms.
And it's so critical to actually kind of look at it and see how your menstrual periods work. So often people can also still get their menstrual period, but they're abnormal. And one of the controversies about it is actually, even though we talk about a syndrome of actually excess testosterone, it also could be excess estrogen and excess testosterone. And one of the reasons is, and we talked about this previously, when people have issues with blood sugar and insulin, one of the hormones that's most affected is progesterone. And progesterone is very critical for having your period and for actually pregnancy.
Right. Progestation. That's what it means. Progesterone, progestation. So interesting. Okay. Sorry. I love those little things. The thing, Keith, is I like to teach people the way I like to learn, because I remember an organic chemistry class back in university. It was just like so ridiculous. Like I couldn't understand anything the teacher was saying. I don't think he understood what he was saying too at times. And so it's like, we need to teach our patients. What does doctora mean? Doctora means to teach, not to tell someone what to do and go bye-bye. No, we need to teach you what you need to do so that you understand what you're doing, and then you can make it better. Anyway, sorry, I had to throw that in. Okay, so talk to me about insulin resistance and PCOS and the connection.
So again, that's where some of the controversy comes from, whether it's a hormonal disorder or an insulin resistance disorder. And we really think about it as an insulin resistance disorder, where what happens is, again, your body makes glucose and in response to when you eat and food. And what happens is your body makes too much insulin. That excess insulin leads to a lot of the hormonal issues. One of them we talked about before is progesterone, right? So progesterone actually will be decreased when insulin goes high, because also cortisol goes up. Progesterone makes cortisol, and then you'll have a deficiency of progesterone. And then what happens is the other end of what we call the hormone cycle is you end up having elevated levels of what we call DHEA. And DHEA is your precursor to both estrogen and testosterone.
To all your hormones, yeah. And when DHEA is low, that's a sign of adrenal fatigue, So there's an interlinking. I'd love to bring in adrenal fatigue into this, Keith.
And maybe that's a great thing for next week, too. We could talk about it.
Wow, the 21st century illness. Yeah. Okay, let's do it. Let's do adrenal. Anyone interested in adrenal fatigue next week, show us some love right now so we know, and also send us some messages on that. Okay, so yes, again, and I just want to touch on adrenal fatigue, because adrenal fatigue can cause cortisol imbalance. I mean, that's what it is. And the cortisol imbalance can affect insulin resistance. Insulin, can you want to explain to everybody what insulin is and what insulin resistance means? Because I think for us to talk about it, it's great, but you explain it so well. Can you tell everybody here? Thanks for all the love.
Thank you. So insulin is a hormone made by the pancreas. And what it's made in response to food coming, whether it's carbohydrates, whether it's protein or fat. And its mechanism is actually to take those macronutrients and actually bring them into the cell to be used as energy. What insulin resistance means is that the body ends up making more insulin than it actually needed before. And one of the things we talked about in the past is insulin is one of the major markers of inflammation. But it's also a marker of fat storage, which we all know we don't want, right? Especially during this period, excess fat storage. So inappropriate levels of insulin is problematic. Heart disease, things obviously obesity we talked about, cancer. A lot of the cancer studies are now linked to excess levels of insulin. So you want to actually make less insulin because that allows your body to regulate its other hormones better. And that's what we talked about, estrogen and testosterone. Excess of insulin does lead to excess production of testosterone for the body in women.
It's like Goldilocks' porridge, though. You don't want to have too little insulin, right? And you don't want to have too excess. So you want to, it's kind of like a balance. You want to be able to have the optimal amount of insulin, and you want that insulin to also be sensitive. Okay? That it's about not just a quantity of insulin, it's a quality of insulin. So super important to have the insulin be sensitive. And there are a lot of things you can do that you can eat, you can drink, you can, take supplements for that are going to sensitize that insulin. We'll be talking about that in a minute. So don't leave us.
So what's important, and again, I want to talk about also why you need insulin. So without insulin, you can't hold on to muscle. So anyone that's a bodybuilder or trying to, build lean muscle, you need some insulin. And me, both of us, and we need some insulin to work. So what sensitization of insulin means, you don't have to make as much. Oh, I love the shoulder pads. And don't have to make as much
for
the body to work. And again, it's about efficiency, right? So the more efficient the body works, the better the body works. There's another end to this, right? If your body is resource deficient or it's not handling nutrients properly, that's another reason why your hormones could be off, right? It could be from not making enough substrates, we call, to make your hormones. So if you don't move fat into the cell properly, you're not going to be able to make your hormones from that fat.
See, these are so important, these facts that we need to know and understand. Sorry for my yellow tongue. I'm having my turmeric.
Anti-inflammatory.
I'm always doing anti-inflammatory. So in terms of if you're concerned you might have PCOS, you can go to your doctor and you can get a full physical exam. We recommend getting a full pelvic exam, an internal exam, pelvic ultrasound, really easy to see. Although, Keith, not everyone is good at looking at cysts on the ovaries. Even slight deviations of what the ovaries are looking like can indicate a cyst, because cysts can be quite small, but mighty and potent. So again, make sure that you're regularly screening for that. And you go to somebody who really knows what they're doing.
And it's also the type of ultrasound, I'm sorry to interrupt, people often do a transabdominal ultrasound where they're looking from the abdominal. The ovaries are in the back. You're often going to miss that. You have to do a transvaginal to really get a good view of the ovaries. And with this disorder, it's not only that you can have ovarian cysts, but also you can have large ovaries. So not everyone necessarily has cysts, because cysts can also differ where you are in your menstrual cycle as well. So what happens is you want to do it in a period when you're usually around ovulation to your end of your period, so you can actually see more likely those cysts being there.
So also, the transvaginal ultrasound means there's a probe and it's inserted into the vagina. And when you insert it, you can actually see on the screen your gynecologist will show you what your ovaries look like and will measure them for you so that you have a baseline, of what your ovaries are looking like, if there are any cysts, if they've shrunk. So all of those things are super important to do. There's also blood tests that they will do, right, Keith? So FSH, follicle stimulating hormone, which affects your ability to get pregnant if your levels are too high as you get older, and sometimes can be normal when you have PCOS as well, but it's still a good test to do. Luteinizing hormone as well. Testosterone, of course. Why? Because we see elevated testosterone levels quite often in PCOS, but not necessarily. Estrogen and HCG, AMH as well, right? Anti-Mullerian hormone. This marker I find, it just checks to see ovarian reserve, but I really don't think it's 100% of a perfect marker. I always like to look at blood tests in combination. I don't like to look at one marker alone. So also we want to do lipid profiles. We want to look at your glucose. We also want to measure your insulin. Keith loves doing this test. You know which test I'm talking about, the glucose tolerance test?
I basically carry around a needle with a syringe and a tube.
That is like the worst test. Why don't you tell it? I mean, what I mean worst test, it's like the most irritating test to do, but it gives you really good information. Keith, can you talk about that test and, let everyone know to tell their doctors to do it on them?
Sure. So
their doctors are going to hate you too for this, because it's not fun for us to do as well on patients.
Correct. And it's time consuming. That's why people, and what it really is, it's what we call a glucose tolerance test. It's in response to a glucose load. Often that will be about 75 grams of sugar in a drink. It's a disgusting tasting orange soda-release drink.
So bad.
And what we're measuring is actually how the glucose and insulin respond to that. See, why often these insulin resistance disorders are missed. We often only do a fasting glucose and insulin. Ironically, that can take years and years of insulin resistance for that to be elevated. What's really elevated before that is actually what we call postprandial or post-glucose tolerance, glucose and insulin. So you'll see it after a meal, which we're kind of simulating, that your insulin levels will rise, and eventually, as it progresses, your glucose rises. What people often forget is polycystic ovarian syndrome is actually a pre-diabetic condition because it is a form of insulin resistance. Yeah. And years ago, I used to measure it out to 6 hours. People don't like that anymore. Usually now we measure it out 3 hours so they can actually go home at some time. And what we're looking for is actually oftentimes the insulin rising, and it could be the glucose rising or the glucose could be falling. And oftentimes where it's missed is doctors will do a glucose level and they will be normal.
Right.
But it's the insulin that's the factor we really need to look at.
So what if the insulin is rising after a glucose tolerance test? It's normal though to have insulin rise, but to what degree?
Right. And also it's a relative marker. And this is where people are often confused. So if you look at the lab values, glucose and insulin could both be normal, but the relativeness of it could be abnormal. Let me give you an example. So if you have a glucose level of 80, an insulin level of 15, which is normal, is probably inappropriate, which is too high. Right. So if we continue to follow that out, that glucose level will probably drop. So again, you got to be careful because remember, an insulin level is in response to that previous glucose level. And if it's inappropriately high, it will continue to drag that glucose level down in the bloodstream.
So yeah, I mean, and this is where I think it's really important for practitioners to really understand how to read tests. And, tests like this is not fun to do, but it gives us really good information. Now, a lot of the time, if we don't want to do the test, quite often we can know that this is happening with the patient because we've known the patient for a long time and we know this is a problem. So quite often, we'll do the test and patients are really not sure and, they don't believe you sometimes and you can say, okay, I'm going to show you. Or, you can just go ahead and treat, which is what I do quite often because to have someone dragged in for that kind of testing is tough, although it does give good information. Did we miss any other tests that one would have done for PCOS?
So I just want to bring up the LH and FSH, which we talked about.
Yes.
So one of the things you will see, and it's not always clear, is the LH will usually be 3 times the level of the SFH. So that we'll see again. Thank you. FSH, tongue twister.
I just wanted to clarify the tongue twister.
But what happens is some people who don't have normal hormone production, that could be low and that could be not as easy. Even when we measure testosterone, progesterone, estrogen, and we talked about this previously, people often with digestive disorders will have low hormone levels across the board. So they could have still a normal testosterone, but when it's looked relative to your progesterone and estradiol level, it could still be relatively high.
Interesting. And again, these are all things that you can speak to your doctor about and educate them, guys. A lot of my patients educate me all the time, and it's great. I love learning. He who thinks he knows everything really knows nothing. So the more we learn from you as patients, the more information you give us, and think of us as detectives. We're constantly looking at the underlying cause of why you're having this happen. And again, the treatment, I want to go into treatment because of timing here. And of course, we want to ask some questions. Guys, don't forget to ask your questions because this is your time to ask anything you want. We're going to go into treatment now. There's 10 amazing vitamin supplements. There's an amazing diet lifestyle. that you can incorporate for PCOS. Let's get into diet first, because that is the foundation. Without the diet, we don't have anything. So let's talk about diet, Keith. What are we recommending for our PCOS patients in terms of protein, carbohydrates? Let's talk about sugar. Let's talk about all of those things.
Okay. Actually, I'll define how they become glucose, right? Because one of the things is we want to prevent glucose introduction, right? You want to have less glucose or less carbohydrates, because that does stimulate insulin. So if you look at the 3 macronutrient groups, first is carbohydrates, and we know pretty much 100% of carbohydrates become glucose. The exception is some of the insoluble fibers where you're not absorbing. So when you look at protein, and I think this is where we often forget, 40 to 50% of protein can become glucose. The body can, through the liver, convert that protein into glucose. Yeah. And so what's important is then you look at fat. Fat, it's roughly about 10% of fat becomes glucose. But one of the key elements of that is you actually need some fat to regulate your blood sugar. So protein in the absence of fat, great examples, people have egg whites. They're often hungry afterwards because a large portion of that is actually becoming glucose and not allowing your blood sugar to be stabilized. And of course, causing insulin to go higher. Yeah,
exactly. So what about food combining?
I'm a big fan of that. So that's my style. And again, it allows you to have balance, right? I mean, one of the key things, and it's also sustainability. I think one of the biggest comments I always get about diet, okay, I'll do this for a week, but week 2, forget it. Right. You want to come up with enough that you can balance your blood sugar by not raising your insulin, but also create satiety, tongue twister, excuse me, and as well as, foods that you enjoy and balance. And what's interesting, when you look at carbohydrates, it's also timing matters, right? Again, before exercise is more important than before bedtime, right? You don't want to have a lot of carbs before bedtime where your body's going to take that excess carbohydrates and store it as fat. Most people, I'm pretty sure, are not running in their sleep to burn.
Speak for yourself, Keith. I exercise every night in my dreams.
Unfortunately, you don't get the results of that, right? You don't get the benefit. And what happens is you want to really watch when you have it and use more of those carbohydrates early in the day when you're more active, so it doesn't end up being stored as fat. Really critical, because when your body has excess carbohydrates, it's going to take the protein and fat and store that as fat until it uses up those carbohydrates first.
Right. Exactly. So we want to have lean proteins as part of our diet. So mackerel, salmon, fatty fish, make sure that they're healthy sources. They're not farmed. We look at kale, spinach, dark leafy greens, rich in folate, which helps with DNA repair, helps with estrogen metabolism. Dark red fruits, we look at red grapes, blueberries, really key antioxidants. Because think about hormones going dirty and going rancid, because that's what happens when they don't metabolize out of the body well. And these foods help keep it intact. And then fiber. Fiber is so important. Beans, lentils, high fiber foods. Think about fiber. Fiber, what it does is it binds onto toxins and it takes it out of the system through the bowels. And we need that, because if the liver is doing all this work to conjugate those estrogen, 100% of all your estrogen gets conjugated from your liver. So if you don't have the fiber to bind those toxins and those extra dirty hormones, I call them, and take them out of the system, they're going to recycle and become even more potent the second time. So we want to get rid of those dirty hormones. A little bit of dark chocolate's not bad, because the ancient Aztecs used to use cacao, to celebrate fertility and to use it as an antioxidant, but a little bit of it is not bad. And then using things like turmeric and cinnamon, like what I'm drinking right now. So,
can I make a comment about fiber? So fiber is really interesting. So people think of fiber traditionally, we look at the grain-based fibers. The problem is when fibers are attached to water, it really does not form a stable matrix, and oftentimes can cause bloating or gas. I always think of the thing, when you leave cereal with milk in a bowl, it becomes mush, right? So that's what's probably happening in your digestive tract. When you combine fiber with fat, great example is avocado naturally, fiber actually works much more effectively and doesn't end up pulling water out of your digestive tract, but ends up working much more effectively as a scrub brush, getting rid of what shouldn't be there. So fiber, ironically, we've never really been taught this, likes fat. Not water, but fat.
Fiber and fat sitting in a tree, KISS. I'm just joking. So fiber and fat.
Actually, you know this, Nigma. Does avocado ever bloat you when you eat avocado? It's a high fiber food, but it doesn't cause any gastric distress to most people.
Exactly. So guys, there's good fats, and you know, avocado is one of them. We have olive oil, we have fatty fish is one of them. So food combining like fatty fish and some fiber is a really nice meal for you. Okay. What do we want to avoid, Keith? That's the easy part.
Okay. So we talked about obviously high sugar foods, refined carbohydrates, you know, but also I think we may also want to watch foods that are high estrogenic properties. Things like peanuts can be that case. Red wine and beer, can also be in that category.
I know.
And again, that's important because, again, remember, one of the key things, and I think people, even though it's what we call an androgenic syndrome, where it's high testosterone, it's actually high testosterone and high estrogen, oftentimes in relationship to progesterone. So you really want to avoid foods that, and we talked last time about plastics, right? And the plastics effects on estrogen as well, that could be problematic.
Absolutely. Absolutely. All right. We're going to ask questions. We have one question, guys. Come on, ask your questions if you have any. We'll go into supplements and then we're going to go into your questions. Keith, so we've got supplements that I know I've used in clinical practice for the last 20 years, and they work so safely and so effectively. Think of vitamin supplements as support in addition to diet and lifestyle. You have to have those down first, right? And then you can take supplements to treat. So the first one is inositol. So inositol, talk to us about inositol, Keith.
So inositol is a B vitamin. It's in the B vitamin family, and it actually is one of the ones we use really the most for polycystic ovarian syndrome because it's very good at regulating your cycle and creating hormonal imbalance, really, and not overacting as a hormone. So we find it very safe. A lot of the symptoms from PCOS actually will go away with that. I mean, and also the other great thing about inositol, it does help with sleep. So if you should take it at night.
Do you do inositol hexanisinate, like the flush-free one?
I'll do that, or I'll do myo-inositol or Chiro D inositol, which are those are the ones that have actually been more clearly studied in polycystic ovarian syndrome. Okay,
cool. And then let's talk about fish oil again. Here we go. We talk about fish oil every week, it seems. Omega-3s. Have it in your diet, right? And if you're not having it in your diet as much because you don't like the taste of fish or whatever, get on an omega-3 fatty acid supplement. It's really, really, it helps you support, it helps with inflammation, it helps support blood sugar metabolism. And we even see that studies have shown that omegas help support testosterone levels and also sex hormone binding globulin, which is the site of which testosterone binds. You want to increase, again, the sensitivity of that site so that you increase proper testosterone levels in the body, but not too much.
Right. You don't want testosterone becoming what we call DHT. That's the mechanism where people will actually have acne and hair loss because and hair overgrowth in other parts of the body.
Exactly. We don't want that. That's for sure. Chromium. I mean, chromium has been around in my life forever, and it's such a great mineral, trace mineral to help insulin work more sensitive, make it more sensitive, basically. That's what chromium does. It sensitizes insulin. And then Vitex, chase tree berry, Keith, amazing.
Right, so chase tree berry actually helps with increasing progesterone levels, but also regulating testosterone and keeping testosterone balanced. Remember, you don't want to get rid of testosterone. We talked about that before. Sex drive is dependent on it, so we want to keep testosterone.
Got to have that.
You want to keep it in proper balance, and chase tree berry does that very effectively.
And then we have N-acetylcysteine, otherwise known as NAC.
So that actually works on insulin resistance. Someone asked a question about what's an alternative to metformin. Right. That is one that often acts like metformin and actually increasing insulin sensitivity and also helping regulate your hormones better.
Is there a particular, I mean, I usually have patients take NAC in the evening, about 1,800 milligrams a day.
I think that's good, but one of the things, it's got to be away from food. So
Yes.
it actually needs to be away from food to be properly absorbed.
Right. Okay, good to note, guys. Magnesium, again. We're
That's
talking
one of
about
my
my
favorite.
husband again.
Your husband, magnesium. So
I
again,
would marry
magnesium.
magnesium if it was a band. I promise.
So again, magnesium, again, a big effect on insulin resistance and increasing. And again, we talked about before, even preventing heart disease, really critical
Yes.
on that.
And zinc, our favorite, you know, zinc is super, super important at stimulating eliminating any extra testosterone that's hanging around that's causing the facial hair. And also helps, you know, with the DHT that you talked about.
Right. So actually, zinc and saw palmetto both work on that same mechanism, and they can be used together. They actually work, it's interesting, the same way that men take a drug to actually shrink their prostate. And what happens is, by doing that, it actually blocks that conversion to DHT, so that testosterone doesn't become dirty. I like that. So you want clean testosterone, not dirty DHT.
Exactly. We want clean testosterone. There's no other way to have testosterone but then have it clean. Vitamin D, huge.
Again, insulin resistance, it's a really key factor in that. And again, what we know even from the COVID-19 world, you know, protecting the body's immune system.
Exactly. Last but not least, folate. We talked about those green leafy vegetables, guys. So, you know, increase that in your diet. Folate is super important with, you know, we know that women take folic acid when they're trying to get pregnant. So this is super important in PCOS. It will prevent, you know, miscarriage. And, you know, approximately, I recommend taking a B complex together along with the folate.
I think important, especially things like B12, B6, all work together, especially people that are prone to the genetic, you know, we call MTHFR. They want to kind of consider a methylated form of folate if that's the case.
Yeah, all the B vitamins, you know, including folate, work together extremely, extremely well. Okay, so that's our supplement. We've got questions here. Let's go to could you do about lifestyle, sleeping patterns, reducing stress? Okay, yes. So next week, I think we're going to do adrenals because everybody seems to want to talk about adrenals. Okay, speaking of hormones, what are the ideal levels of middle-aged women should have?
Well, there's a question to that. So you want to know if you're premenopausal, postmenopausal, perimenopausal, those levels can differ. And the problem with giving proper levels, even in a premenopausal, someone who's having normal periods, it depends on which part of the cycle you're in. So whether you're in follicular, you're in luteal, or your ovulation period, that can differ dramatically. So it's hard to give specific numbers based on that.
Exactly. All right, here we have another question here. Thoughts on gluten-free and dairy-free for PCOS? Absolutely necessary to go dairy-free and gluten-free for PCOS. I have clinically seen this over and over again. Think of dairy as a pro-inflammatory, okay? It causes inflammation. Anyone who comes off dairy, any of my patients who've ever come off dairy and have had acne, the acne goes. I mean, obviously we do other things. We do the supplements and, you know, support their skin in other ways, but the acne goes. And if the acne goes, the acne is just a sign of what's going on the inside. Gluten-free, absolutely. Now, going gluten-free doesn't mean you go and buy gluten-free bread and gluten-free cookies and all that, because that stuff has a lot of crap in it. So when you mean to go gluten-free, look at other alternative grains that you can eat that are healthy for you. And in my book, Younger Skin Starts in the Gut, I have a huge list of foods that you can have. Okay, I have PCOS, PCOD, but all my hormone levels are in normal levels. Is this common?
You want me to tackle that one?
Sure.
So remember, your sex hormone levels could be normal, but you could still have insulin resistance. And that's really critical. So I would actually look as well at glucose and insulin levels, even look at cholesterol levels to see if there is what we call insulin resistance or metabolic syndrome. That can also be consistent with PCOS. And the part in any lab test, and I always tell people that, is one marker may not be as effective. Also, what part of the month did you draw the hormone levels? So oftentimes I'll wait till the 3rd week in a 4-week cycle to draw the levels. This way you see accurate levels of progesterone and can compare that more effectively to estradiol and to testosterone.
I know there's 2 schools of thoughts, because I sometimes look at doing it on the 3rd or 4th day of the cycle and day 19. So it just depends on, you know, what you're looking for. I think both times are important to compare, and always know where you are in your cycle when your doctor is taking your bloods, because that's going to make a huge impact. Let's see, any other questions here? I guess we could do this one here.
I could take that if you want. So ivositol is a form of myo-inositol and chiro-D-inositol and inulin. Inulin, obviously, we've talked about before, is a prebiotic. So that does have a good effect in actually regulating hormones, in addition to a low carbohydrate or controlled carbohydrate diet.
Okay, we'll take one last question because I think it's a good question. I have hirsutism but no PCOS. Is that possible? Absolutely. Well, you may not be diagnosed properly with PCOS. And again, these are diagnoses. Everybody is going to have a different level of PCOS, right? It's just like we can't treat all people with one particular disease the same way. We're all different. So again, I would try to look at some of the tests that we talked about earlier. Have a listen to the IG Live again, and remember some of the tests that we recommend you doing. Maybe get on some vitamin D, measure your testosterone levels, your sex hormone binding globulin. We listed a bunch of tests that you should do that are super important. And maybe, Keith, we can do the same thing as we did last time. We can make up a list of all the tests that we recommend somebody with PCOS have done, so that then they have it in their database to show their doctor.
And what I would only add to that is that your levels could be normal, but actually they may still be off, right? So again, you got to look at also, even if things are in the normal range, you want to look at how relative they are. Is the testosterone relatively higher than your estradiol or progesterone? Again, that's important as well. And other conditions do affect hormonal production. We talked about digestion, thyroid. So a lot of times the numbers could be off, but because there's another complicating comorbidity or co-condition that's there that's throwing off the diagnosis.
I want to answer one last question. Keith, do you have time for it?
Sure.
Okay. PCOS and IBS. Super, super important. Why don't you take a stab at it, and I'll continue and add anything else on.
Okay. So what happens is, again, what happens oftentimes during people's menstrual cycle is constipation is often a big part, actually, especially right before women have their menstrual period. So again, when you have higher estrogen and testosterone levels, oftentimes those digestive symptoms could be even more problematic, especially in that second half of the cycle. And oftentimes I hear more people having more issues with either diarrhea or constipation prior to their cycle, and especially when their hormone levels are off.
Exactly. And it's, again, gluten-free is also recommended for hypothalamic amenorrhea. Absolutely. You know, diet plays a huge role. Inflammation plays a huge role. We have to always look at the underlying cause. Why is something happening? All right. This was super fun, Keith, on the PCOS. Next week, guys, we're going to talk about adrenal fatigue. What is it? What can we do to support it? What foods can we eat? What supplements can we take? Be there or be square. Keith, that was so much fun. I will talk to you later.
Thank you so much.
And
so I will be there because I don't want to be square.
Exactly. You don't have, hopefully your power will be working and we won't have any problems again. All right. Take care, everyone. Happy Wellness Wednesdays.
Have a nice day. Be safe.
Okay. Be safe, everyone. Bye.